Dr. Clark. Yeah.
Hi, everyone, and welcome to the Upgrade Your Healthcare interview series. I am Dr. Bhavna Rao, founder of Meridian Springs Primary Care. We are a direct primary care clinic. Now, what is direct primary care? It is a membership-based model where we see patients on a flat monthly fee basis. All visits are included. No extra co-pays or visit fees charged for any number of visits for the patient to come in. We also include telemedicine for no extra cost so that the patients can reach their own doctor after hours and weekends. This is a very transparent system. We don't bill insurance at all at our clinic, and that is why it's called direct primary care. Now, today we have Whitney Person.
We need disclaimers, so let's not forget that.
Yes. So we are going to discuss different types of insurance availability and with the ACA and the enrollment period. So this is purely for discussion purposes only. And please contact your licensed insurance agent for your own insurance purposes. Now coming to our guest, we have Whitney Person today, and I would like her to introduce herself before we go ahead discuss what options she has.
Thank you, Bhavna. Thank you. And thank you, Sunil, for asking me to join you today. I am very pleased to be here and to share this information. So who am I? I am Whitney Person, Whitney like Houston, and Person is my real last name. But to make that easy to remember, you can call me Whitney, the health insurance person.
That's good.
So, thank you. That's my tagline. So I am a licensed health insurance broker. As a broker, I'm not tied to any one particular insurance company. I represent the entire market. And so I am licensed in 13 states. And I also own my own health insurance brokerage, Serenity Benefits Group. It's domiciled here in Houston, Texas. But as I said, I do work in 13 different states. So that's me, and I am excited to talk about insurance today.
Awesome. So let's talk about what are the insurance products you work with.
Absolutely. Thank you for asking. I work with ACA, or the Affordable Care Act, also known as the Marketplace. Some people know it as Obamacare. And open enrollment for those plans is coming up in 6 days. It is November 1st through November 1st through December 15th. And that's really important, and I'll tell you why in just a second. But I also work with short-term plans, private plans, health share plans. We do child-only plans, Medicare, so all things health.
Awesome.
So this, you said enrollment starts from the 1st of November to December 15th. So tell us more about that. So is it only available during this period and not around the year? And what about other insurances? Are they available around the year?
Great question. So open enrollment is when the public can look into their marketplace options, and it is really a 6-week period where you are looking to enroll into a health plan for 2021. Now that ends on December 15th. If you miss that window, you could be out of luck until next year, until 2022, unless you have a qualifying event throughout the year, such as you move, or you had a change in family size through marriage, birth, death, divorce, adoption, or you lose employer coverage. Other than that, this is the only time that you can enroll in one of the marketplace plans, would be between November 1st and December 15th. So it's a very important window to get coverage for the 2021 calendar year.
Awesome.
Mm-hmm.
So who is eligible to apply?
So everyone is eligible to look into their options. Yes, so it is open to the public. Everyone should be exploring their options. Now, open enrollment, of course, is for the marketplace, but there's still other plans available, such as short-term plans, private plans, health share plans. I will say, though, that those plans, they can be written throughout the year. throughout the entire calendar year, but open enrollment is the window when you can get on a marketplace plan. So a lot of people are really exploring what options are available to them, and they're looking at their current coverage to see if they need to make any adjustments. For example, the marketplace is going to be your best option if you're family planning other than employer coverage, because that's where you're going to find maternity coverage. So things like that you should really think about what your needs are, any pre-existing conditions you may have, or upcoming things that you want to get accomplished health-wise in the upcoming calendar year. You definitely want to make sure that you have the proper insurance in place.
Right.
And
So if somebody is debating about whether to go with private insurance or marketplace, how do they decide?
Well, it's based on a lot of things, right? It's based on their situation with regard to their health, their budget, things like that. So it really is very personal. It's a case-by-case basis based off of their situation, budget, needs, things like that. And so usually what I do when I work with clients, we have a discovery call, a first conversation, and we discuss those things. And from there, there's only so many insurance buckets that you can choose from. And it's pretty easy to knock them down one by one based on what the needs are. But I know that you guys, I really enjoy what you guys bring to the table with direct primary care as a pairing with a bronze ACA plan, or even some short-term plans, because they'll have coverage, let's say coverage for your high claims, such as catastrophic accidents or critical illnesses. But you guys provide the lion's share of, treatment for, your day in, day out, things that people will want to call you for. Such as wellness visits. You guys do wellness, right?
Yes, we do.
Mm-hmm. And
Yeah.
flu, or the common cold, allergies.
Yes, so basically primary care takes care of a lot of issues and prevention. So it's acute issues. We think of children getting sick, adults getting sick, and also issues that come down the lane 10, 15 years in the future. And that is where the preventative and wellness health comes into play. And this is where the primary care gains a lot of importance, because we are thinking down the road 10, 15 years ahead of you to prevent those serious critical illnesses that occur there.
Mm. And so
we have named this. Okay, you had something to say. Yeah, go ahead.
Oh, no, I think we were probably that you guys just have a subscription fee, a monthly subscription, and then you just pair it with maybe where you if, say for instance, you have on the marketplace, you have a bronze plan, a silver plan, a gold plan, and as you go up in those metal levels, your monthly premium or your monthly payment goes up. But it's kind of, there's a inverse relationship between your premium and your deductible. The higher your deductible, the lower your premium. So pairing maybe a program like yours with a high deductible plan is a way for individuals to realize some savings. So that's a great option that I like to educate my clients about.
We have named this the series of interviews that, it's starting with you. This is the first one. It's Upgrade Healthcare by Downgrading the Cost of Health Coverage. And Bhavna has a great chart that, I think you should share it now. It's the teacher's plan that, we have spoke about before. Can you share that?
No.
Okay. Okay, you carry on. Let me check the desktop.
Yeah, definitely. So as Whitney, you just mentioned that the deductibles matter. and it is related to your premiums. Now, people always think that the low deductible plan kind of protects them better because their expenses are lower. But rarely do people look at their premiums and see the correlation between a low deductible plan and a high monthly premium, and the savings that they may get by choosing a high deductible plan with a low monthly premium. And the chart we're about to put up shows that it's not from, of course, it's a previous year's plan, but the differences are there, a big difference that is almost about, you can save almost about $10,000 in premiums and out-of-pocket expenses. We all know that not all of us meet our deductibles every year. In fact, very few of us meet our deductibles every year. So there is definitely an advantage in choosing a high deductible plan which gives you a lower premium. And that's where direct primary care comes into play. Since we have a flat monthly fee, we take care of all issues within that fee. No costs, and you're not paying every time you go to the doctor's office. And that, first, number one, makes people use their primary care more often. And number two, saves them because they're not paying out of pocket for every single visit, which they would otherwise pay. So we want people following up with their primary care as often as possible, and not trying to avoid going there just because they have to pay the visit fees every time.
Okay, I shared that picture.
So this is what we were talking about with the premiums and the out-of-pocket maxes.
So it looks like this is the teachers' retirement system of Texas. Of course, this is the 2018, 2019, but it's a great thing to discuss. People usually think that they can go to a lower deductible plan here, the gold plan, and maybe they cannot afford if they have to pay that much. But when they do the math, I'm like, okay, what? It doesn't make sense to me. So the savings in deductibles is $2,500, but then the extra premium that they're paying is almost $10,000. So you're paying $10,000 to save $2,500. So what exactly is going on? I mean, do you want to talk about something about this, or what do you think?
I mean, I think that depending on the individual's personal needs, if it depends on what they have going on. Do they have a lot of usage? What type of services are they going to need? If they have, if they're going to the doctor regularly, or they want a close relationship with their primary, but they also want to make sure that they're protected for any possible protected against, any major claims, then definitely, the direct primary care paired with a high deductible would afford them some savings, or it's an alternative to a gold plan, and certainly should be priced out and explored.
Yeah, so that's what we tell that if they pay or if they pair the bronze plan with the DPC, we take care of 80% of all the healthcare issues. And whenever they need a specialist visit or hospitalization or any of those big ticket things, that's when they dip into this, which makes a lot more sense than paying that $10,000 extra. Again, I think there are cases like you mentioned where they would need a gold plan. It's so, yeah, but I think people, when they're deciding what to do and which ones to pick, should do the whole math, which is a great equation here, to see the whole cost of healthcare,
Exactly.
and not just the deductible.
Yep. Indeed, it's definitely good to have this type of demonstration to show how, just by tailoring, certain things to your client's needs or to your patient's needs could really work in their best interest.
Yeah.
Yeah, and we all at Meridian Springs, we always counsel our patients to have a plan as a backup for catastrophic events like this, so that they're well protected and it's a all around health coverage.
Absolutely.
Right.
Primary care plus a great catastrophic plan, which is not eating away your bank account, but actually doing the job it has to do to prevent that big bill that you get with a
Which is
catastrophic.
where Whitney comes in. And I think this is the right time for you to give your contact number, phone number, email, or how do they contact you?
Yes, absolutely. So you can first check out my website, serenitybenefitsgroup.com, and that's benefits with an S. My business phone number is 713-969-0404. But I tell all my clients, feel free to call, text, or email me anytime. So I'm actually going to give my cell phone number as well, which is 646-420-4015.
Awesome. Awesome. And another question I had was the short-term plans.
Mhm.
How well do they how do they work, and do they pair well with a DPC membership?
Yes, they do. Short-term plans can be as long as or as short as 1 month and as long as 3 years. And they're going to cover you against any new illnesses or injuries from your effective date of coverage. So you can choose your deductible. Actually, there's deductibles ranging anywhere from 2,500 all the way up to 25,000. So you choose your deductible, and as we said, you have your monthly premium, which is your monthly payment for an insurance policy. You have your deductible, which is the amount you must pay before insurance starts paying anything. So, like I said, the lower your deductible, the higher your premium is going to be. So what we're discussing here is a strategy where you can raise the deductible because you have a closer relationship with your primary care physician.
Mhm.
And that is going to lower your premium. So a lot of people choose that as a strategy to make their health coverage more affordable. And so, yes, they pair well with short-term plans, to answer your question.
Awesome. So again, I would recommend everyone go talk to your health insurance advisor. If you cannot read the numbers or figure out what your costs are going to be, sit down with them and ask them to break it down for you to understand better. That would be the relationship you need to have with your health insurance agent.
Yes. And if you don't have one, then Whitney is the person. Whitney is the person.
Literally.
Yeah. One question related to the short-term plan. So do the short-term plans cover the same things that a regular ACA plan covers, or are
They
they
do not.
different? Oh, they do not.
They do not. That's why it's important to have a prudent agent that speaks with you and understands what your needs are, because they are going to cover and not cover very different things. So the ACA is going to offer very robust coverage. There's 10 essential health benefits that have to be covered. We spoke about maternity. It covers pre-existing conditions from day one. Short-term plans are going to operate differently. So it's very important to understand the differences between the different types of coverages, because they're going to work different. They're also going to be different price points. So that's why it's important to have a good strategy, not just always just choose the cheapest thing, because sometimes you get what you pay for, right? You really have to understand how each coverage is going to work and pair them correctly.
Great.
So hopefully that's helpful. But yes, speaking of pairing it correctly, the having a close relationship with your primary care physician, you, Bhavana, and then where they can reach out to you. It's a subscription, right? So they have access to you as much or as little as they'd like, and then that helps them with the lion's share of their health concerns. But if they, God forbid, are hospitalized, that's what they have their insurance in place for.
Right.
Right. And that's where our whole our whole motto for this season comes into play is upgrade your healthcare, but downgrade your health costs. And these are the discussions we're going to have in the next few days, wherein people can actually, learn more about different options they have.
Absolutely.
Yeah.
And
And
thank you for having me as a guest.
oh, thanks for joining us. I think you've answered a lot of questions, and I know people will have a lot more questions on their mind.
Mhm.
And we are going to put your number and your website and your email address on our social media posts,
Great.
so that if they want to contact you, there's a way to contact you. So
That
great.
sounds.
Thanks for joining us, Whitney.
Thank you,
Thank
Whitney.
you for having me. Yes, it's open enrollment. It is the time to look into those options, guys.
November 1st.
Yes.
Thanks.